Quickly with the stats, our midnight census was 371. Our Bryan Easy Visit questionnaires that have been completed are 12,339, resulting in 4,205 Bryan Easy visits, and 1,992 have used the COVID promo code. We won't be reporting these numbers going forward. We're having a change in our process now. Easy Visit will go back to its routine kind of Easy Visit functionality. And now what people will be asked to do is just go to bryanhealth.com. At the top banner, there's a COVID testing information, and people should click on there. It will make things more efficient as supplies have loosened and screening criteria is pretty well ironed out. There's a different way to process physician orders. There is going to be some information on there about your ability or to offer your insurance information, but it's important to note, and it is noted on the site as well, that if you are an uninsured patient, you absolutely can still take the test and so forth. So a slightly different process, so we'll be phasing out the Bryan Easy Visit, which, if you remember, was the very first thing we set up to begin trying to get a handle on what was going on in the community. Let's go with the stats here. We have now tested 4,591 times, resulting in 552 positive results, 3,580 negatives. And we have a big number of pending from yesterday's drive-through operation. We have 459 pending. I want to take one moment just to, frankly, shed a little of our humility here. As of this morning, at least from the website that we all have access to, Lancaster County has tested 5,031 people. Again, I know some of ours have come through the mobile inquiry, and we've had, a few come in from outside the county. But at Bryan, again, we have tested 4,591 of those, so a significant percentage. So I think in the next couple of days, we're going to hear more and more about what is coming from Test Nebraska into Lancaster County. We couldn't be more grateful that someone is coming to alleviate some of this. It will not deter what we've been doing at all, but thankful that there's going to be some assistance in the community on testing. Again, it's kind of in that theme of shedding the humility. It's something that we've been really proud of here at Bryan. No one asked us to set up the drive-through clinic, and we did. No one asked us to set up the mobile clinic, and we did, and so forth. And it has resulted, again, in 4,591 tests being administered and only 5,000 in the entire county. So, again, welcoming them to the community to help us out, and then very proud of what our team has done here to serve the community. So with that, I'm turning it over to John.
Thanks, Bob. Just talk a little bit about the numbers. Bob mentioned we have 459 pending. A lot of that is due to the fact that 329 of those tests were administered yesterday at the drive-through. So we'll be getting those back in our traditional 36 to 48 hours. We have 23 positive COVID patients in-house. 12 are from Lancaster County, 11 are from outside the county. 6 on ventilators, still the same number as we had yesterday. 8 are in our intensive care unit, 4 in our progressive care, and 11 in our general care. We are still planning to go to Crete tomorrow from 1 to 4 or to 5:45, and that will be at the Crete utility site as we had gone to in the past on 9th and Oak Street. And in relationship to our elective surgeries, we're continuing to see those climb day after day. We seem to be handling that extremely well. We're still sad to the part that we don't allow visitors inside of the hospital, but it's just part of what we need to do to keep control of the number of individuals that are coming in the organization. We feel our medical staff has done an extremely good job in screening individuals. So a lot of the electives that we're doing are relatively healthy people. Those individuals that are compromised, we're still holding off those elective surgeries till later, and we will just continue to monitor this each and every day. With that, I think we'll turn it over to any chat questions.
just want to reinforce some things as we prepare to open back up more and more as a community and as a state. Wearing masks is really, really important. The primary reason to wear a mask is to protect others. Washing your hands is really, really important, and the primary reason for that is protecting yourself and others. And then same thing with the social distancing, that helps protect you and others. So all three of these things combined are going to be important. We've kind of mentioned that there is more testing as the supplies to do more testing have released a little bit. Places like Bryan, the ability to test internally was a big one. And then, yeah, absolutely, you're seeing more and more people. The screening process was always in place. It was just pretty restrictive. You had to screen to get a test. There's still the same screening criteria is in place to get a test, and there are more sick people that are meeting the criteria to be tested.
As we talked about before, I think we believed that we were going to start to see our peak occur, and we are seeing that. I think the plant that we have in Crete has added to this as well, not just Lincoln as the county, but think about there's people that live in Lincoln that do work at that plant, so we're seeing a higher number. I do think being able to do more testing, we will continue to see more positives. As we stated before, we've seen about a 10%. It could probably rise to higher than that, especially if we have not taken advantage of dealing with the situation at hand. So no matter what the plant does in regards to separation of individuals, it's really about what are they doing when they go home? Are we able to separate them and isolate them from their other family members? Some of the cultures that we have, that's hard to deal with. And that's what we're trying to work through is it's not just dealing with the businesses that may have an outbreak, it's really those home environments. And then how do we take care of people to get food to them and other things that they need? I will tell you locally, some of the things that our health department is doing, I think, is outstanding. They're trying to figure out ways to get food to individuals and keep them isolated in their homes. Because in most situations when people are living in tight quarters, they almost have to consider everybody in that house as a COVID positive individual. Somebody has to allow them to get access to food and other essentials that they need. But I think also you always have to remember that if nobody's working in that household, it's very difficult for those families. So I know there's a lot of agencies that are coming together to help these individuals. There's, the utility companies are allowing people to wait for a period of time to pay bills. All of those are really crucial things, and that I think we're going to continue to see these numbers climb for a while as we deal with those other issues that arise in the community.
Initially, it's absolutely right. The very sickest were getting tested. Even those with, the symptoms, if you remember early on, they were with the limited test supplies, were instructed to go home and self-isolate and watch themselves. So there are more tests certainly being done now for people that meet the screening criteria. So the screening standards haven't necessarily been relaxed. It's just the availability of testing has allowed it to be opened up. The percentage of positive is higher, absolutely. I think it's a combination of what you asked there, Matt. Minor symptoms weren't being tested early on, and it is an indication of wider community spread of the disease. And then if you remember back to when Dr. Nora presented, and we've had some conversations on this, that the false negatives early on, as we were getting our hands on this or around this as a country, were certainly there, and the accuracy of the test is much more reliable now.
When you think about when we first started doing this and people were coming in pretty sick, we were also at the end of the flu season. So a lot of people had influenza. There's other respiratory illnesses that were going on at the same time. So I think you had that combination of things happening. But now I think the coronavirus or COVID-19 is more widely spread, so you're starting to see more of it. But again, we always talk about I think a lot of people have this, but they have it from a minor symptoms perspective. It's keeping it away from those individuals that are compromised in some other way. So we were getting daily reports in relationship to all of the critical access hospitals in the Heartland Health Alliance. We were able to see what their current census was at the time and what their capabilities were. And now we have that all filtering into one central point. And right now we're not seeing any uptick in those areas. In fact, there's actually been a downplay in those other areas just due to elective surgeries. And we've seen a big reduction in that. But we have always been available that if they have a person that is testing positive for COVID, we'll normally get them transferred into Lincoln for that. And a lot of times, if they even feel somebody's having those symptoms at a severe rate, they won't even do the test there. They will just send them into Lincoln because we can do that more rapid test here right inside of our facility.
I agree. I'm growing mentally tired and physically tired of the social distancing. And as much as we like, talking to you guys, we wish we were talking about other things at this time every day. What would you tell people to keep it up? I'd say as hard as it is, and heck, we read the echo chamber comments out there that I don't even know how you guys deal with it all the time, some of the stuff people post on your sites and stuff. But why it's important is we are just hitting our surge right now, and we have flattened the curve. As you've heard the governor say, as you've heard the mayor say, as you've heard John say, flattening the curve doesn't necessarily take people necessarily out, it just spreads it out so we're not overwhelmed. It is so important until we have a vaccine and treatments for this. It's the most effective deterrent, is my opinion.
Yeah, I think it's a very tough situation because we like to hang out with our friends, we like to be with our families, and it is difficult. But if you really think the longer term, do you want to expose a loved one to this virus? Do you want to expose your friends to it? And I know it's difficult to do, but we do have other electronic mechanisms to stay in contact with people. And I think we have to think about that. I know we've given some insights into how you stay healthy mentally. Take advantage of those. You can still connect with people in other ways. And I know it's difficult, but when the weather starts to get a little nicer, which it has, you can get outside a little more too. But again, remember about the social distancing. At least kids can get to play in the yard. I know there's a lot of parents that are homeschooling their kids, and it's a totally different environment than it had been in the past. And sometimes they need to let those kids get outside and burn some of that energy. But yeah, it's difficult. But look at the gain of this by doing the social distancing, and look at not exposing other individuals to this virus. I am not aware of individuals with COVID-19 being transferred via helicopter. I would say if an individual is having breathing issues, which could be totally unrelated to COVID, it could be a condition that they have, an underlying condition. But typically when they come on board and we're looking for other signs, we will probably do a COVID test as well. But I have not heard of a big uptick in relationship to air transportation for these individuals. It's funny, I just read this article last night, and they basically say take your glasses and put them in soap and water and rub it on there quite a bit. And then when you go to take them out of the soap and water, just run them over normal water to make sure you have no soap on them and let them air dry. And then when you put them on with your mask, they won't fog up. I haven't tried it yet, but if you'd like to, that's at least the story.